Joining us right now, we have Dr. Chris Sanborn with Erlanger to talk about possibly the next step for many, and that is bariatric surgery. Let's talk a little bit more in depth of what bariatric surgery is.
Sure. Well, let me maybe explain what it's not. It's not a way to avoid diet and exercise. It's actually a way to help people diet and exercise. So we're able to kind of do the opposite of what you usually see with the diet, where somebody basically starves on the diet, and so they feel that starvation and they feel the decrease in energy, so they can't get out and do the exercise and stay on it for very long. So we can do things to the stomach or the intestine, sometimes by taking out a portion of the stomach or bypassing it, that will actually decrease the hunger hormones, increase those hormones that make us feel a little bit more satisfied with the meal, and actually support our metabolism while we're decreasing those calories and allow us to lose weight.
Now we got a couple of examples here, some props that you guys use here when explaining this here. We'll kind of pop this up here a little bit.
Sure. I brought a couple of them just to show some of our more common operations, and this is the gastric sleeve operation. And in this one, we're taking out most of the stomach, and we'll leave the stomach as what we term as a sleeve, or kind of a banana shape there. That helps decrease hunger hormones, helps increase those hormones to make us feel satisfied with the meal, and supports our metabolism.
Okay. And we got the next little example here too.
Here we go. And we'll take a look at that one there. And this is the gastric bypass. And what we do in this one, we're bypassing the stomach in this first portion of the small intestine to get a lot of those same changes. And so there's different reasons that we talk about in our seminars why we do one versus the others, but these are the most common ones being done today in the United States.
Now you kind of mentioned at the beginning of the interview here, this is not a deterrent to not diet or not to exercise, but really who is that target candidate?
Right. Well, we want to have patients that have come in after having tried those things. A small percentage of people are going to be able to do that on their own without additional help. Okay, but there's a lot of people that can't. So we don't want to do it on people who haven't tried. We want people who have tried things, they've tried to lose weight. Now, if somebody wants to know, are they big enough for bariatric surgery, then they just go online, do like I do, go to Google, BMI, see what their BMI is. So BMI of 35 and above with medical problems would probably qualify for surgery, and the BMI of 40 and above would usually qualify on its own.
And you're finding people that they just don't want to exercise. That's not the case. They want to. There's that desire there, but being obese might prevent them. It might be something to where they can't get on a treadmill because of their legs and the extra weight. But this is also a way to sort of help them achieve that goal too. Because you are finding people that do want to exercise, want to do things.
It would be extremely rare for me to see somebody who hasn't tried almost everything under the sun and doesn't want to get out and do that exercise. We have a portion of our packet that has what you've tried before, and usually it just looks like the stars at night. It's just checked everywhere. And they have a little section with why do you want to do the bariatric surgery? And a lot of them are to be able to exercise and get out and do those things and be more active.
Now, of course, one of the best things probably to many doctors that are out there is being able to work with robots, and of course the robotics has certainly helped out with the surgery too.
Right, it's interesting. The robots, they've come out, the Da Vinci robots, what we use. At Erlanger we have the latest version, the XI, and it's great, allows us to do some things that we can't normally do with the laparoscopy. Ultimately, though, our outcomes are the same. So they're no better, no worse with the robot. And I think what that shows us is our rates of complications, major complications from the laparoscopic surgery over the last 10 years have decreased so much, it's hard to show an improvement on that. You probably have to have a study of 50,000, 100,000 patients to show that. So it's actually showing us what we've got is already really good, and it's really just a different way of doing it. Eventually that technology will catch up, and that'll be the way to go.
You mentioned just a few moments ago seminars. You guys have two seminars. You got one that's going on tonight, another one that's going on tomorrow in Cleveland. What are we discussing in these seminars?
Well, a little bit of what we've already talked about, and we're going to expand on that. We'll talk about obesity, why we have the problem with obesity, and the problems that we can get from the different medical issues and things like that. And then we'll talk about what we can do with that, and that really involves a lot of the surgery, the complications of surgery, the expectations from surgery.
Of course, you got one tonight at the Erlanger campus at 6 p.m. and then the Fairfield Inn and Suites in Cleveland tomorrow at 6 p.m. That one being tomorrow. One last question, the success rate that you see from this. There's those naysayers that say, well, it's just going to go right back to the way they were before, but you're not really seeing that. You're seeing good success.
We're seeing good success, and if you take a look at overall numbers, about 80% of people are going to lose at least half their extra weight. Okay, so it still leaves 20% that lose a little bit less than half their extra weight. Okay, some people gain back more. Okay, that's why it's important to keep doing that diet and exercise.
All right, for more information, of course, when it comes to bariatric surgery, you're more than welcome to contact the folks there at Erlanger. It's 423-778-LINK. Again, 778-5465. When you call, ask them about the seminar. Again, that's taking place tonight at 6 p.m. at the Erlanger campus in Chattanooga, or tomorrow at Fairfield Inn and Suites in Cleveland at 6 p.m. Both seminars are free. You can also go to the website, which is erlanger.org. As always, thanks a lot, Doctor.
All right, thank you.
Folks, we encourage you to join the